God,
grant me the serenity
to accept the things I cannot change,
the courage to change the things I can,
and the wisdom to know the difference.
In this edition of Overcoming Addiction, we will focus on prevention in Malden and beyond. Tonight's guests are Ashley Wright, Program Coordinator with the Malden Board of Health, and Lauren Dustin, Program Coordinator for the Mystic Valley Public Health Coalition. Together we can make a difference. Here's your host, Paul Hammersley.
Welcome to another show of Overcoming Addiction. I am Paul Hammersley, and I am the president of Malden Overcoming Addiction. And on tonight's episode, we're going to be talking about prevention in Malden and beyond. And I would like to welcome my guests, Ashley Wright, Lauren Dustin. How are you?
Good.
So, we all know the disease of addiction, how bad it is, what's going on, and what we're all facing. And I know that you two are working directly in contact in the field, and you're sharing a lot of good and great information just amongst the cities that we're in. And I would just love to hear what Mystic Valley is doing, Ashley, what the Board of Health is up to. So pretty much we're just going to jump right in, dive right in, and get all this information out for our folks to hear. And Lauren, tell me exactly, what is Mystic Valley Public Health Coalition, and what is your role?
Sure. So Mystic Valley Public Health Coalition was actually started over 10 years ago as an emergency preparedness group. It involves several health directors from local towns around our area. And then they started to expand to focus more on substance abuse prevention in the schools and among youth. And they, as a region, as a public health region, they were able to apply for several grants that are regional cluster grants. And that's one of the grants that I coordinate is called MOPSI, and it stands for Massachusetts Opioid Abuse Prevention Collaborative. It was awarded to the city of Medford in 2013, and it focuses half on primary prevention of first use of opioids, and the other half on prevention of things like overdose and death from use of opioids. So we work together as a region, 6 communities.
Mystic
one of them,
Valley with MOPSI.
Yes.
Is that okay?
So the MOPSI grant is a grant awarded from the state to the city of Medford, but it operates within the Mystic Valley Public Health Coalition, which involves 7 communities, one being Malden. So I coordinate the MOPSI grant, working with people like Ashley and yourself.
So what other communities are you guys in?
Yep, so the MOPSI grant covers Malden, Medford, Melrose, Reading, Stoneham, and Wakefield. And then we have another grant called the SAPSI grant, and that's Substance Abuse Prevention Collaborative. That's coordinated by Liz Parsons in Melrose, and that also involves Winchester. So we are a team of 7 communities.
And you're helping in the schools, what exactly is, are you in the school system, or you're spreading the word type of thing?
Sort
is that
of.
What's happening?
Sort of. So the grants that come from the Department of Public Health are really focused on making long-term systems, practice, and policy change. So we're not actually the ones going in and teaching a health curriculum, although that's part of our job is to help a community or a school district to be able to do that. We might host a training for teachers to learn more about a certain topic. That way they can then go in and teach their own students in their district. So we're not actually doing a lot of the educational programming, but we're trying to help a community or a school district or a municipality to increase their ability to address these issues long term. So rather than just going in and doing one educational program, we're really teaching them to be able to do these things time and time again.
Yeah, and I just wanted to mention, first off, thanking Mystic Valley, because I remember it was about 2 years ago, and you guys sent 3 of us from Malden Overcoming Addiction to become recovery coaches.
Perfect example.
You guys, you had the grant and you had some extra money, you contacted us, and 3 of us went out to Worcester, and we were able to become recovery coaches.
Yeah.
And that's amazing stuff, and I just wanted the people to understand exactly what you guys are about, what you're doing, the resources that you have, because you're amazing at what you're doing, and that's awesome. And Ashley, so tell me, Ashley, you're in Malden. What is your role in the work that you do for the Malden Board of Health?
So a little like Lauren's work, I'm a local coordinator, so I work on a grant called Partnerships for Success, which also comes from the Department of Public Health, and SAMHSA, which is the Substance Abuse and Mental Health Services Administration. It's a federal agency, and they gave us this money to focus on primary prevention of prescription drug misuse in high school aged youth. I'm housed out of the Board of Health, and I do like Lauren was saying, a lot of policy and procedures changes, environmental, working with the schools, working with partners in the community. Partnerships for Success is our grant. So much of my work locally is making partnerships in the community with the schools, with MOA, with places like Malden's Promise, Cambridge Health Alliance, and working with them to provide them with resources, information, skills, to really build their capacity to do this work in the long term.
Yeah, it was last year, I think about a year ago, we also worked together on In Plain Sight.
Yeah.
You were on board for that, and we did a lot of planning for that, and that was one of the events where folks could come in and actually look at a room that technically was a child's room where we would hide things, paraphernalia, drug paraphernalia, and see if parents could find them where kids were, where we thought kids today were putting their paraphernalia, and we worked very closely on that.
And so that's one way that, you know, my grant, and even without using money, that's one way that we were able to work together with our community partners, MOA, to help to educate and build the capacity of parents to have these conversations. You know, we brought them resources, were available there. We had some people there to talk to them if they had questions. I know we had a police officer that was present at the events during the hours that parents were there to really talk to them and educate them and to help build their capacity to have the conversations with their kids and share kind of the prevention messages.
And the police actually brought some items that they had confiscated from kids that we could show the parents, so it was just a very good collaboration between you know, all of us. And
yeah, and I think that's really important. Part of this is to make sure that people are having conversations with each other in terms of working across sectors, like, you know, Lauren and I are working in prevention, and you know, providing so many resources in the community for recovery, and knowing that there's such strong connections and networking and, you know, opportunities for us to support each other and to work together and to do this work, you know, more meaningfully in the community and to provide the best work that we can, and working across sectors is so important in that work.
And that's why I felt this was very important for the three of us to sit down, because currently the three of us are working on something a little bit different for a grant, but the three of us are actually sitting down monthly going over how can we better the community, how can we get the message out there, and I just think it's really a good idea that we let everyone know exactly what we're doing in this field, and if they need help or resources, they can contact any one of us at any time and get the resources they need in the prevention field. And speaking of prevention, what is prevention? In terms of substance abuse, what is prevention?
So prevention is kind of a difficult concept to grasp because it's not something that you'll really see the long-term impacts of. It's hard to measure prevention, but you can't measure something that didn't happen. Someone who didn't use substances maybe, and you may not know why, because there's a whole range of factors why someone chooses to use substances or not. So in the grants that we work on, we focus a lot on primary prevention. That's prevention of first use of any substances in terms of talking about substance abuse. So that might look like a health curriculum in the middle or high school for all students. It's a universal prevention strategy. Then we also do things that are more targeted to maybe youth who are at risk, maybe youth who have been caught drinking at a party or smoking marijuana in a car. They're encountered with police, they might be sent to a diversion program. So that kind of prevention is to prevent that issue from getting worse. And then we also focus on, with the MOPSI grant, very early on, we focused on getting more police departments to carry Narcan. So that would be an example of what we call tertiary prevention. That's preventing a disease from getting worse or preventing a death. So with police having Narcan, they're preventing someone from dying from an overdose.
That's a perfect example of prevention. Yeah, so some people
and recovery supports, recovery centers, recovery programs, also tertiary prevention, preventing relapse.
So could you almost put prevention and education together, or because people get it confused. They hear the words and they're confused. So that's what we can do here tonight. Now, would we sort of put that on the same level? I think it's a little bit different. Education and prevention, it all goes hand in hand, and we need to do both. But, you know, could you try to define education and prevention? Is that something we could try to delve into a little bit?
Yeah, I can give you how I differentiate it, and then maybe Ashley can add something. So when the work that I do under the MOPSI grant is because we're not focused on doing any educational programming really at all, we might do that to help a community to learn more about a particular issue. If Malden is having a big issue with vaping or something, we might bring in a trainer to teach teachers about what to look for.
Exactly.
So that's not a long-term strategy. So our long-term strategies would be something like changing the school policy to make it easier for the school to discipline or divert a student to a diversion program if they need some individual attention. So prevention is much more than education. I think education is part of it, but it also involves the policy change, the systems change, the attitude change, the change in beliefs, the change in behavior ultimately.
So education, basically, kind of like Malden Stop the Stigma Day. So basically, we go in to the schools, we see about 3,300 students, and we explain to them what stigma is. We're educating them on what stigma is. That's not prevention. They're not doing anything wrong. We're educating. So I'm just keeping the show that simple so people understand that are watching, that are trying to learn about what we do. And some people don't know what Narcan is. So all of these things that we're doing, so education and prevention, two very different things, and we do both.
I think at the base definitions of both prevention and education, I think education is the first step in prevention. If you want to compare the two or use the two together, I think education, understanding a topic or understanding something like a school policy, or even bringing in a health curriculum like life skills that was brought into the high school this year on another grant. That the school.
Let me stop you right there. Life skills.
Yes.
Tell me. Like I love this because no one really understands what has happened. A lot of folks missed it. Please explain the life skills, what it is, because I think it's amazing.
So I have learned a little bit about life skills since I took this position. And what life skills is an evidence-based curriculum. So it has a lot of research behind it through its implementation over the past several years.
And it went into
through
a certain
Botman.
grade, right?
So in Malden, Life Skills was purchased by the use of a grant called the Youth Opioid Prevention Grant that came through the Attorney General's office. And it was implemented this fall, or this school year, in the 8th grade in Malden.
And that was like $20,000 worth of.
Something like that.
Yeah.
Yeah, there was some money that came
Amazing.
through the AG's office. Yeah, and it was really great. Healthy Me Institute for Health and Recovery is working with the school to provide support in their implementation of it. And I know that they have plans to, build off of the 8th grade implementation, depending on the results, which I'm sure are going to be great. It's a really great program. I think Life Skills is a step in the right direction to kind of, solidify a health curriculum in the schools and to really start to educate
So
our
let me
kids
get
on
it
the
clear. We're
topic.
in the school
Yeah.
right now at the
Yeah.
8th grade level, and that's what I
Yes.
love to hear. Like, it's actually getting in, and it's.
Yes.
We'll take 8th grade. I'd love to go lower, but for this point, that is actually being. It's
Yes.
introduced as we sit here.
Yes, in the 8th grade. And I know that in Life Skills, I believe you might be able to go lower, but I know that there are at least 6th grade curriculums that are available to be introduced. And so I'm sure that the school is looking at all of their options, but I know, at least in the early conversations that I was a part of, that they were looking to expand it.
Now, you mentioned one of the latest things that you guys just put a lot of effort in, and that was the book, the handbook, for the high
Yes,
school.
the school substance abuse policy.
Like, let's hear about that, because I know that was, for lack of, I don't want to say lack of a better terms, but it needed some updating and fixing.
So we
and,
upgraded the school substance abuse policy per one of our grant strategies.
and who was with you on that?
We had a large planning group, a large working group of people from the school's superintendent's office. The former high school principal, Ted Lombardi, was unbelievably involved and helpful. The school adjustment counselors, school nurses, the former school resource officer from the police department, yourself was in a lot of our conversations. I don't want to shortchange anybody.
No, it's okay, but
School-
just to give an
school,
idea, what did we do? What is this for?
So what we did was we sat down with a lot of community stakeholders, community partners, and worked with the school to upgrade their school substance abuse policy to move from simply being you're not allowed to use, you'll be punished, to really understanding the responsibility to share clear expectations of behavior for youth when they're at school or at school events or on school property, that, you know, there's a responsibility that comes with, with you being there. There's an expectation of your behavior, and it's expected that you will not use substances. You will not come to school or a school-sponsored event with any sort of alcohol, tobacco, marijuana, or other drug, including prescription drugs, or under the influence thereof. And the policy and procedures was written not only to be a punitive, but to be a restorative, and to make sure that there is going to be an effort made by administration, and they were, you know, more than happy to get on board with a shift towards social emotional learning, and to really make sure that students are being connected to trusted adults in the community, to make sure that students are being connected to resources. You know, we understand in the field that a high school kid who's using marijuana chronically, showing up to school under the influence, you know, there's probably some underlying mental health issues going on. There's something that they're not getting in their lives somewhere, and making sure that we're addressing those issues and not just sending them home, you know, not just getting them in trouble, not just taking things away, because that's not, you know, that's not effective prevention.
And the teachers need to be reading this book as well to follow through. And it's amazing what the work that you guys did. I know how much work you put in on that. And that was, when I went over it, it's amazing to see. So like hats off to you, and like we're making a difference, you know, one kid at a time. So Lauren, tell me, what does prevention look like on the local level? Like,
on the local level, well, Ashley already touched on a lot of things going on locally in Malden. I kind of see it
regionally, whatever you want to go.
I was going to say, I kind of see it more as a regional. Since I'm a regional coordinator, I kind of work with all the communities to help them to implement their local prevention strategies, or come up with new ones if they're seeing new data trends. So I work very closely with Liz Parsons in Melrose, as I said, coordinates the SAPSI grant. And we work together really, as I mentioned before, to
what
increase.
What is SAPSI?
So Substance Abuse Prevention Collaborative.
Just for folks to, because people
yes,
don't
another
get
fancy
the
acronym. Yeah,
that's right.
We have a lot of those.
We speak in all acronyms.
That's okay, and I will interrupt. And I just want
fine.
everyone to understand exactly
Yes.
what these things are when they see them.
So that grant is focused on underage drinking and marijuana prevention. Again, policy change, systems change, practice change. Not so much doing a lot of real education in the schools. It may start with that, as we mentioned, but it's just like the MOPSI grant. So Liz and I work together to. We convene planning meetings, planning groups. We do a lot of short-term action teams to complete a certain project. We've done anti-stigma PSAs, so we might have a small group that works on that for a short amount of time. We work with local boards of health. We update them on what we're doing, what other communities are doing. We really are trying to increase the readiness and the ability for a community to implement prevention strategies, whatever it is that their community needs. Myself and Liz, the other coordinator, were there to kind of support them in that, and whether it's through funding or resources or convening groups of people to kind of talk about an issue together. We do a lot of those types of things regionally.
That's amazing, and I want to touch a little bit on medication boxes. You know, there's been a lot of talk. I have elderly parents. A lot of pills are going through the house, and for many different reasons. Doesn't have to be opioids, but there's just a lot of stuff that an elderly person is taking. Some stuff goes out of date. Some things, you know, people do pass away, and there's all this extra medication. And one of the main things that I hear is a lot of people don't know what to do with the medication. Whether do they flush it? Like, can either one of you talk to me about that? Like, what should people be doing? Where is there a place that people can go and drop off their medication? What should they be doing?
Yeah, so safe disposal of any type of medication, over the counter or prescription drugs. And like you said, any type of prescription drugs, not just opioids.
Right.
You know, people have, you know, depressants, stimulants, heart medication, asthma medication, different things, and prescriptions are for yourself, and there's a lot of different factors that go into those. And whether it's I accidentally took something, or, you know, somebody is going in search for that, it's really important to not only store your medication safely, but when you're done with it, whether you don't need it anymore, it's expired, somebody passes away, it's really important to dispose of it properly. We don't recommend flushing it. It's not very good for the environment.
Correct.
And there are, in Malden, we worked with the police department and some of our other community partners to reestablish a medication disposal box in the police station at 800 Eastern Ave. It's in the lobby of the police department. It's completely anonymous, free for use. You can walk in.
You can walk right in and put
Yep.
something in, no questions asked.
Yes.
Okay.
Absolutely. We do also, to note, have sharps disposals. So the medication drop box in
And
the
what is
police
sharps
department.
disposals?
So for needles and syringes.
Needles, if people do have
Yes.
needles. I have a
Yes.
dog that's diabetic, so some people might be in that
Yes.
same position, and what do they do with all the needles?
So the
that they-
medication disposal box at the police station is for over-the-counter and prescription medications. We do have 3 locations for needle and syringe disposal in the city. One is at the senior center in their main entryway. One is at the Board of Health on the 2nd floor of 110 Pleasant Street in my office. And the other is at 630 Salem Street, which is Malden Senior Housing.
That's amazing. So at any point
Yes.
you can get, so there's all your information you need right there to drop off used needles, medication. That you guys are both doing amazing work.
And
so
I also, sorry, I don't
No,
mean to cut you
go
off.
right ahead.
If somebody passes away, if an elderly person passes away and their spouse is looking for somewhere to dispose of their medication, this came up in our conversations. I just want to share for anybody who runs into this problem where they're unable to get to the police station to drop those things off, give the Malden Police Department a call and explain that to them, and they'll be more than happy to help you.
that is fantastic information. Lauren, I want to switch gears. I'm reading here on some of the research that, did you recently have some of your work featured on WGBH's Greater Boston?
Yes, yes.
You
So
want to tell me about that?
Sure. So one of the things that we did when we first were awarded this grant in 2013 is we wanted to see how many people in our communities were actually dying from opioid overdose. So we do that by looking at local death records. I actually visit all of the community clerk's office and flip through the books myself to record every overdose that has happened that's opioid related. And one of the trends that we saw from that data, we were able to see it by occupation. So what the person's job was that was last listed on their death record, what their last job was. And we started to see a trend in that 42% of the overdoses in the Mystic Valley area were somebody who had worked in the trades or labor type occupations. So
Interesting.
that's construction worker, roofer, landscaper, things like that. And we thought that that was a huge number, so we wanted to look further and really figure out why this is happening. So we talked to a lot of people who work in the field, a lot of key stakeholders, and we wanted to learn more. And we're now in the process of coming up with a strategy and action plan to figure out how to really address this issue and how we can reach people that are in that population, people that work in the trades, so how we can prevent the use of opioids and prevent more overdoses from happening. So,
Wow,
yeah.
that's amazing. And if people wanted to get involved, like locally, how could people just get involved? What can they do?
Yeah, if they want to get involved with the Mystic Valley Public Health Coalition as a region, if they're from one of those communities that I mentioned, they can get in contact with me. They can email the Mystic Valley Public Health Coalition or get in touch with Ashley.
So Ashley, do you have any words for people that might want to get involved?
Yeah. So
Please,
if you
go
wanted
ahead.
to get involved on the local level, you can go to our website. It's cityofmalden.org/substance abuse. And there's plenty of information there. I regularly invite people to become involved in MOA. If you'd like to get involved in the local prevention efforts like ours, send me an email. We'd be happy to kind of talk to you and see where you might fit. And there's also, we've been working with Malden's Promise Coalition to create
Fantastic
a
coalition.
subcommittee to really focus a little bit more on aligning prevention, treatment, and recovery efforts in the city. And so if you'd like to be involved in that, we welcome anybody to come around the table and sit with us.
And they can just contact
join
you?
the conversation. Yeah, I'm more than happy to be the contact for that.
And what is
too.
your email?
It is A as in Ashley, Wright, W-R-I-G-H-T, at cityofmalden.org.
Fantastic. Now, do either one of you, do you have anything coming up that you would like to talk about? Is there an event? Is there anything happening that maybe people need to know about?
Yeah, so we have a couple events that are really geared a little bit more specifically for certain people in the community. So we have a drug impairment training for education professionals that's being offered February 8th. And you can contact Lauren at the Mystic Valley email. And that for more information on that. And we also have I don't want to butcher the name, it's called Weeding Through the Myths. It's a train the trainer for anybody who works with young people who want to educate them on vaping and marijuana use. And that's sponsored by the Melrose Substance Abuse Prevention Coalition, and that is February 14th. And you can contact either one of us for more information on that too.
So that's for both of you? That's what we have coming up?
Yeah, the DITEP training that Ashley mentioned, it's a 2-day training.
What is DITEP?
It's the drug impairment training for educational professionals. So
okay.
there's the first day is for any school personnel. The second day is only for school nurses, because they're going to be the ones that are going to be doing that drug assessment to see if a student might be impaired at school.
Okay.
So that is February 8th and February 13th of the 2 days.
Awesome.
Yeah.
And I do want to just let people know that if you are struggling and you might need help and you're not sure what's happening, you can contact Malden Overcoming Addiction. You could reach out to us on Facebook at Malden Overcoming Addiction, on Twitter at Malden Overcomes. You could email us directly. Our phone number is 781-838-2203. If you may think you have a problem and you might want to get with a recovery coach, we have coaches on hand that can help you, talk to you. They're resource guides, get you any resources that you may need, but please contact us, and we really want to thank you for tuning in. I want to thank Lauren and Ashley personally. Thank you so much for coming on. And again, we'll see you next month. We would love to have you tune in, and thank you.